Hello everyone, I am Dr. Srinivas, lead orthopedic consultant at Aster RV Hospital, Bangalore, JP Nagar. I want to talk something about osteoporosis today. Osteoporosis is basically weakening of the bone or reduced calcium content in the bone. Normally, our bones have 96 to 97% of calcium content in the entire body. And this calcium deposition happens during your childhood or when the child is growing in the mother's womb itself. And gradually the calcium deposition increases during the childhood and adolescence and reaches a peak between the age of 20 to 30. If any person or any sports person or a person who is active physically, if they are involved in sports, physical activity or agricultural activity, any physical activity, they usually reach a peak bone mineral density. If somebody, especially Indian woman, gets married and has childbirth between the age of 20 to 30, they may not reach the peak what we expect. That's the reason we always suggest youngsters to do a good exercise, be healthy, having healthy food, adequate sunlight exposure, so that they reach the peak bone mineral density at the age of 30 to 35. After 30 to 35, invariably every year 3% of their bone calcium starts coming down. Over a period of time they come down so much, when it reduces below the 60% of the average population, we call it as osteopenia. When we cross or when we come down below 30%, we call it as osteoporosis. When we reach osteoporosis level, it is alarming stage. There is a very high chance that patient may have spine fracture, hip fracture, shoulder fractures. Smallest of trivial injuries can cause fractures. So we need to prevent osteoporotic fractures. To prevent osteoporotic fractures, we need to be in high bone mineral density so that over a period of time we reach osteoporosis very late, maybe 60 years, 70 years. If you don't reach the maximum bone mineral density between 20 to 35 years, you will reach osteoporosis at 50 years, which is not acceptable. First thing to prevent osteoporosis, be very active during your younger age group, maybe any sporting activities or any physical activities. Being more active causes increased bone mineral density. When you reach osteoporosis, you need to reach your doctors to see what is the cause of osteoporosis, whether it is a senile osteoporosis, that is age related, or because of hormonal post-menopausal osteoporosis, or any endocrine related issues or trauma related. There are multiple reasons. You need to reach out to your doctors, consult them, diagnose what osteoporosis is, then start off treatment. Treatment can be multiple modalities. It can be calcium supplementation, vitamin D3 supplementation, or bisphosphonate supplementation or hormone supplementation. Irrespective of whatever treatment it is, meet the doctors, whether it's orthopedician, endocrinologist or a physician, diagnose the root cause of osteoporosis, start getting treatment so that we can prevent fractures. We are committed for the bone health and for our society. That's the reason we are educating people to prevent osteoporotic fractures. Have a great day.